Wow, thank you so much. But we now have Justin. This day is just getting better and better. So Dr. Justin Feinstein, have I said that right? Feinstein, very good. Clinical neuropsychologist and director of the Float Clinic and Research Centre, Laureate Institute for Brain Research. He's got to set up his Mac. So Justin's laboratory investigates the effects of flotation REST, which stands for Reduced Environmental Stimulation Therapy, on both the body and the brain, while also exploring its potential as a therapeutic treatment for promoting mental health and healing in patients who suffer from anxiety and stress-related disorders. Dr. Feinstein's research has been published in a number of top scientific journals, been featured in the popular press, including New York Times, Time magazine, and, wait for it, Australia's Sunday Night. So over to you, Justin.
Thank you. Could we just give a round of applause to the Mental Health Association of Australia and New Zealand? This was a great conference, and my first time in Australia, but it sort of illuminated me about how diverse Australia really is. When you go to a mental health conference in America, it's very sterile. It's very boring. You don't get talks like we just had, and I think this is really part of being here in Australia. There's a great diversity of culture, and I've really appreciated that. I'd also like to thank Tony Bazil, who is in charge of the Flotation Therapy Association of Australia, and she's coordinated my visit out here. I've come a long ways. So, to begin, floating provides a window into the lowest reaches of our brain, a window that allows us to see the rhythm of our life unfolding in real time, a window that allows us to feel the flow of sentience, completely untethered from the external world. Now, the rhythm I'll be discussing today is one of anxiety. It's a rhythm that constantly outpaces the beat of life. And importantly, it's a rhythm that could be slowed down by floating. I come here today from Tulsa, Oklahoma, a state located quite literally in the middle of America, some might say in the middle of nowhere. And it's here where I work at the Laureate Institute for Brain Research and direct the Float Clinic and Research Center, a laboratory I finished building about 4 years ago to study the effects of floating in those with anxiety disorders. Now, before we dive into the details of what floating is, it's worth putting this research into the context of the society in which we currently live. We are the guinea pig generation, where smartphones and constant connectivity have become part of our daily existence. And the human mind struggles to break free from this nonstop stream of stimulation. About 5 years ago, the preeminent journal of Science published a study that nicely demonstrates this. It's titled, "Just Think, The Challenges of the Disengaged Mind," and it goes like this. In 11 studies, we found that participants typically did not enjoy spending 6 to 15 minutes in a room by themselves with nothing to do but think, that they enjoyed doing mundane external activities much more, and that many preferred to administer electric shocks to themselves instead of being left alone with their thoughts. Most people seem to prefer to be doing something rather than nothing, even if that something is negative. So as I'm developing my laboratory and this study comes out, and I'm thinking to myself, all right, now I'm going to take patients with severe anxiety and put them alone just with themselves for much longer than 15 minutes. This is the cultural context that we're living in. People are scared to be with themselves. And in many ways, to me, floating is the antidote to this. Now, when I talk about reduced environmental stimulation, what do I mean? People always say, well, can I float in the ocean? Can I float in my bathtub? Well, you can. But it's not this. When you're in these calibrated float environments, you're trying to minimize sensory information coming into the brain. So let me show you what that looks like inside of a float tank. Everything from vision to hearing, proprioception, speech, movement, tactile sensation, thermal sensation, taste, smell, all of these sensory channels and cortical functions are reduced to an absolute minimum while you're floating. And let's not forget, the brain does not live in a vacuum. There's the tail of the brain, the spinal cord, that every moment of the day is making adjustments to accommodate for the forces of gravity. And even that is reduced. So it doesn't take a neuroscientist to realize that's a lot of cortical real estate that's changing inside of a float tank. And if you were to say, Google the word float tank right now, a lot of what you see looks quite small, like tiny boxes or pods. And I could tell you not a single patient I studied would have gotten into one of those. So that was a big barrier to entry. How am I supposed to study this in patients with severe anxiety disorders if they won't even go into the float environment? So we put a lot of work into this. I had an engineer from England fly out and live with me for about 6 months. And we decided, you know what, let's get rid of the enclosure altogether and create a wide open float pool. The room around the pool is created to be soundproof, lightproof, temperature and humidity controlled, and by doing that, you could get rid of the whole enclosure. It's only a foot of water, but in it we have a full ton of Epsom salts, 900 kilos. So when I say floating, I mean you're on a mattress of water. It's now denser than the Dead Sea. You don't have to move a single muscle to stay afloat. And the temperature of the water and the air is calibrated to be the temperature of your skin. It's about 35 C. The patient is in complete control. They could get in and out of the pool whenever they want. When they have the lights off, the room is completely dark. Not a single photon of light is coming into the retina. But if they want the lights back on, there's an infrared wave system. They just wave their arm and the lights turn on and off. There's an intercom system where we could communicate with the patient in real time in case of any adverse events. And the idea is to create a sanctuary for the patient where the experience is theirs. They're in complete control the entire time. So this was the company, Float Away, that helped me make this. And about 4 years ago, we implemented it, started studying how this works, how to conduct research with this and measure things. I'll show you some of that data soon. But this was the first set of float studies in patients with anxiety disorders. And I'm going to present to you some of the data. The first study came out last year. It was an open label trial in 50 patients. The second study also came out last year, and this was a small RCT in 30 patients. And all of this could be found online at a website called clinicalfloat.com. There's a whole repository of PDFs of the various studies that have come out, both from our laboratory as well as other laboratories. Now, we wanted to select a group of patients who are rather severe. We had a database of treatment-seeking patients in the local community. And we didn't want to focus on any one particular disorder because these were early-stage studies. They were safety studies. They were tolerability studies. One point to make here is no one had ever floated before. We did exclude for relatively severe psychopathology. And the cohort that we ended up testing sort of spanned the whole spectrum of the anxiety disorders. We had a lot of GAD, social anxiety, some panic and agoraphobia, as well as a number of people with PTSD. And it was a highly comorbid group. In fact, 92% of the sample also had comorbid major depressive disorder. So the first study was very simple. We told the patients, you could float for up to an hour with the lights on or off, your choice. And this is what the findings look like. Now, I should preface this next slide by saying, a lot of the patients looked at me kind of like that science paper. You want me to be alone with myself for an hour? No, I'll get out after 5 minutes. That was sort of the intro that we often heard with this patient group. But in fact, what you see here is 48 out of the 50 patients stayed in the entire hour. We did have one patient who left early, she had some cuts on her back that she wasn't even aware of. And when you're in a full ton of Epsom salt, ouch. So if you have any open wounds, this is not a good idea. And another interesting thing is about half the patients floated with the lights off, and the other half had the lights on the entire time. And we did look at these groups separately, and one of the interesting things is it didn't matter in terms of anxiety reduction. You could have the lights on or off. We were seeing a similar amount of anxiety reduction. In terms of the clinical changes measured from pre to post float, we did see reductions, significant reductions in negative affect and pain, fatigue, sleepiness, depression, state anxiety, stress, and then the biggest one is muscle tension. But it wasn't just reducing symptoms of mental illness, it was enhancing aspects of mental wellness. And the patients were not coming out of the experience euphoric or manic. In fact, the positive aspects of the experience were really in this area of relaxation and serenity. It was a low arousal level of positive mood and affect that we were seeing. In terms of effect sizes, these were all large effects. And the biggest effect in terms of reduction was state anxiety. When we broke this down into the different types of patient populations we were studying, or whether people had the lights on or off, or even whether they were taking medications or not, you could kind of see here, across the board, state anxiety had the largest effect, a Cohen's d greater than 2. So this was a highly reliable effect across the whole cohort. And in fact, you could take a look. Here's the raw data on the Spielberger State Anxiety Inventory for all 50 patients. And we didn't have a single patient who didn't show a pre to post float reduction in state anxiety. Not everyone had a large drop, some were kind of small, but it seemed to be that the patients who brought the most anxiety into the experience with them were the ones that had the most precipitous drop afterwards. When we compared this group of 50 patients to 30 people who were completely healthy, no psychiatric history, and who also were having their first float experience, take a look where the post-float anxiety levels landed in the patients. Kind of where the healthy subjects were starting out at. So this was a really profound drop in anxiety for the patient cohort. Nevertheless, this is an open label trial. We wanted to understand more what was happening in both the body and the brain while the anxiety was dissipating in the patients. So we set up another study, this was the RCT, where people got randomized to either the Earth condition, which is a fancy way of saying they watched the BBC Earth for 90 minutes. We got rid of all the gore and the sex scenes. It was just mostly serene landscapes and the British voice. Or they got randomized to float in the pool for 90 minutes. And during this, we didn't just want to collect self-report data, but we actually tried to measure things. And this was not trivial. I have a whole warehouse of equipment, kind of like a graveyard, really, that was destroyed in the process of trying to figure out how to measure things in an environment with a lot of salt and a lot of water. But nevertheless, we found ways to do this. And we were able to measure everything from EEG brain waves just on the frontal channel, to EKG, to blood pressure, and breathing rate. And I'll present some of those data now. But in both conditions, these measurements were being taken. After they completed one condition, they would come back 2 weeks later and do the other. So here's what the data looks like. One thing to point out is the film condition did induce some serenity and relaxation and did reduce state anxiety a little bit, but you could see the magnitude of difference between the float and the film condition. It was having a much more profound relaxation response. And once again, look what was leading the way in terms of reduction. Muscle tension. You know, this could be a very important aspect of why floating is helping these patients reduce their levels of stress and anxiety. And we wanted to figure out more of what that looked like. So we had all the patients trace on these little mannequins, these little Semana maps, where they were feeling tension. And these are heat overlap maps where you see areas of red. That means over half of the patient cohort was reporting tension in that area. And most of the tension was being carried in the upper and lower back. And you could see even during the film, that didn't change at all. Pre-float, a very similar pattern. But then during the float, all of that tension in the back just dissipated away. And you could imagine if we're carrying all this tension around in us all day, every day, what that does to our stress and anxiety levels. It's something that I think as a field, both in psychiatry and psychology, we often ignore. We're so stuck in the mind, but we're not always conscious of what's actually happening in the body. But it's not just the skeletal muscles of the back that seem to be reducing in tension. It turns out our entire cardiovascular system is lined with smooth muscles. And there's a way to objectively measure the tension within this system using blood pressure. So in red is the film condition and blue in the float. And you could see within the first 10 to 15 minutes, systolic blood pressure drops about 5 points and then stays that way for the remainder of the float, a significant drop in blood pressure of about 5 points. The shaded areas are 95% confidence intervals. Diastolic blood pressure shows an even more precipitous drop. Within the first 5 minutes, you see this large drop of about 10 points, coming down to about 15-point reductions in diastolic blood pressure. And you could sort of look at this as a change from baseline to see that a little more clearly. Now, this is a very large relaxation response, and we found it in every single patient we've tested so far. It seems to be reflexive to the environment itself, and we're now trying to understand how this is working. It's possible that there's a vasodilation created in the float environment. We also looked at heart rate variability. And in this case, it actually went up, which in the case of heart rate variability is a good thing. The high frequency especially is really considered an indicator of the parasympathetic nervous system. And so we found this increase, this significant increase in heart rate variability, and the degree to which heart rate variability improved during the float was significantly correlated with the degree to which anxiety reduced during the float. We also tried to understand in this study how long are the anxiolytic effects lasting after a float's over. These are about 1-hour sessions. And then the participant would go home and we would ping their smartphone every couple hours for a few days to track the time course of the effect. And what you see is a clear pre to post float drop in stress and anxiety that continues for 2 hours, 8 hours, and 20 hours post float before starting to come back to baseline. Those are 95% confidence intervals. Serenity levels showed a similar pattern, going all the way out to about 20 hours post-float. This really struck me because the current gold standard treatment in America for rapidly reducing anxiety is a highly addictive drug known as a benzodiazepine. And if you were to take, say, a Xanax to help take the edge off of your anxiety, the half-life of that is about 4 to 8 hours. The fact that we're still seeing reductions in anxiety and improvements in serenity over a day later suggests that this is actually having some sort of powerful effect on the nervous system. And in fact, going back to the original slide of what floating is doing to the nervous system, it seems to be in some way resetting it temporarily for about a day. And how is that happening? How is the fact that you go into this very simple environment where there's nothing there but yourself for 1 hour, how are you able to establish that? And it made me really think hard about what else is happening during a float session. So many people refer to floating as a form of sensory deprivation. And if there's one thing I want you to take home from today's talk, is never call it sensory deprivation. That's a misnomer. In fact, there's this huge input coming in from the internal world of the body, a concept I refer to as interoception. And that is the center of your conscious awareness while you're floating. You feel your heart beating. You feel your breath. And it's this experience that I think is highly important for the reset to happen. We actually measured it. We had those little somatomap tracings, and we had the participants tell us, where were you feeling your heartbeat? And you could see pre-float, just a few people were feeling it in the chest area. But during the float, the entire chest wall, you could feel your heart beating, and you could actually hear it as well. The environment creates this almost stethoscope-like effect. We also asked participants how intensely did they feel these internal sensations, and it wasn't just the heartbeat, but it was the breath. The GI system didn't seem to show much of an enhancement. It was really cardiorespiratory sensations that were changing. And it wasn't just them feeling it more intensely, they were attending to these sensations more. Keep in mind, I gave no instructions that this was going to occur. This is just their spontaneous report from the float environment. And this creates a paradox. Some of you in the crowd might be saying that to yourself. You're saying, wait a second, you take somebody with panic disorder, you remove everything else from the world around them, and you just focus them on the very sensations that normally bring them to the emergency room, right? How many people have had a patient whose heart is fluttering and they run to the ER thinking they're dying of a heart attack? Yet here they are in this float environment having a profound anxiolytic effect in the midst of these sensations. And this got me thinking as well, how could this be? And it turns out there was a profound theory that a lot of people have forgotten by a psychiatrist named Joseph Wolpe, the person who invented systematic desensitization and things like progressive muscle relaxation. And the theory goes like this. If a response antagonistic to anxiety can be made to occur in the presence of anxiety-evoking stimuli so that it's accompanied by a complete or partial suppression of the anxiety responses, the bond between these stimuli and the anxiety responses will be weakened. What he was trying to say is that it's physiologically implausible to be both relaxed and anxious at the same time. And in this environment, if he had known about floating, he would say you could be pairing various anxiety-evoking stimuli with this relaxed physiological state, and you will have a weakened bond. That suggests that actually what's happening in the float environment may not just be a short-term anxiolytic effect, but in fact you can now return to the real world, and that learning should transcend the float environment. Do we have any evidence of this? Well, it turns out not a lot, mostly anecdotal. For example, one of the patients in my current study who's been floating repeatedly had severe social anxiety and also a severe fear of public speaking. And when you would ask her about the fear, it was really about the heart palpitation. She'd be up on stage, her heart's palpitating, and all she could think about is, how do I get out of here? Well, after floating for many times, she noticed that even though the heart palpitations were still there, her reaction to them had dissipated. In America, we're starting to see that every single professional athlete team is installing float tanks in their locker room. But it's not just for the recovery of intense workout. MVP players like Steph Curry and Tom Brady are talking about it as helping them cope in those last-second situations where your adrenaline is pumping, where if you're distracted by that adrenaline rush, you're not going to be able to focus on the task at hand. And those are the players that always come through in the clutch. So let's break this down a little bit. This is the last slide. What do we know and what do we not know about this theory of reciprocal inhibition? So I've color-coded it into 4 different hypotheses. The first one is that floating will reflexively shift the nervous system into a physiologically quiescent state, one that's antagonistic to anxiety. And I've shown you data today that floating reduces your muscle tension, lowers your blood pressure, improves your heart rate variability, and decreases your exposure to all external triggers of anxiety. The second hypothesis is that floating will enhance cardiorespiratory sensations, the very sensations that have been associated over the course of life with the experience of anxiety. And we also have data now to support that. The third hypothesis is that through a process of reciprocal inhibition, floating will suppress the anxiety responses, leading to an acute reduction in the experience of anxiety. And that was the data I showed you in state anxiety reduction. Every single patient we've tested so far has shown a pre to post float reduction in state anxiety. So we do have some data to support these first three hypotheses. But there's a more important hypothesis that will be articulated, and that is the fourth one. Over time and with repeated exposure, floating will lead to sustained reductions in anxiety sensitivity. It's your sensitivity to these interoceptive sensations. The bond between cardiorespiratory sensations and the experience of anxiety will be weakened, and a competing association will be formed, one that links the experience of cardiorespiratory sensations with relaxation instead of anxiety. And to me, this is the most important hypothesis because it suggests that the effects of floating may be able to transcend the float environment. But in order to test this, you need to do a longitudinal RCT. You need to randomize people to a control condition or floating multiple times and then follow them up 6 months later, a year later, and see when they go out into the real world, re-encounter all the things that make them anxious. Are they able to cope better? And I'm pleased to announce that last year, the National Institute of Health gave the first federal grant to study this exact question. So we just started this trial. And I hope to be able to come back in a few years and report on the results of this final hypothesis. With that, I'd like to thank all my collaborators who were involved in this, and also offer you guys something that the Flotation Therapy Association of Australia has made available to every delegate at this conference, which is free float sessions in Australia. You don't have to fly all the way to my lab. So through the month of August, if you have this code, IMHC 2019, you could float for free, which is actually quite nice because most float sessions in Australia cost anywhere from $50 to $100. This is one set of float centers that have offered it. And then this is the second set. So thank you guys, and thank you for welcoming me into this country.
You made it to the end. Justin said, I just want to get to that last slide, but he didn't tell me that it was like free float sessions. I wouldn't have really been sort of going, sure, what a bonus, that's fantastic. When I arrived yesterday, Justin, I was looking for a bath in my room. I don't know if it's quite the same, but I was very disappointed when I just had a shower. But there is a spa here, so maybe we need to have a look while we're here. I think we've got a few minutes for questions. Questions, anyone? Yes, maybe this lady. Where's Isabel or someone? Thank you.
Hello, thank you so much for this presentation. Really enjoyed it. And I'm really happy to hear that you've got the money to test the last hypothesis. Forgive my ignorance, but I have never ever heard about floating and flotation therapy, despite the fact that I have been trained and do research in medical psychology. So I don't know how new the whole field is. But my questions, from what I understand, you showed lowering of blood pressure, for example. So two populations that come to my mind, those with low blood pressure, and would that be something we could expect some sort of adverse events? And what about people with liver disorders, because when I think Epsom salts, I link it with detox, and I wonder how many people actually would not be able to benefit from flotation.
Yeah, it's a great set of questions. The first one was about whether, if you're lowering blood pressure and you already have low blood pressure, is there a possibility of an adverse event? This worried us as well because we wanted to use this to help women with anorexia nervosa who have notoriously low blood pressure and also orthostatic hypotension. And so we've actually just finished the safety trial in about 20 patients with anorexia nervosa. And what's fascinating is it didn't actually cause any orthostasis. In those patients, it seemed to actually neutralize some of their orthostasis. And in fact, I haven't shown anyone this yet, but I'll tell you guys, normally heart rate gets a little bit lower during floating, but in the anorexic patients, it actually raised a little bit, which for them who are in a chronically low heart rate state was actually healthy. So that was kind of a fascinating piece. The second question was about the magnesium. You're in a full ton of magnesium sulfate, and would this cause any issues with people who maybe have liver or kidney issues? It's a good question. We don't have a complete answer. We are studying magnesium in the blood and the urine pre to post float, and we're not seeing clear evidence of absorption across the skin. But it's possible that it still could be getting in.
My question may not make too much sense, but floating is a form of therapy, as you're saying. So what is it with floating that stimulates or triggers the brain to take away the anxiety? Is it the water and no sound, or the fact that you've relaxed? So that's, I'm trying to find out what's going on in here. Thank you.
It's a great question, and I think when you see that slide of the brain, this is actually manipulating a lot of different sensory channels. I think it's very hard to isolate any single channel that could be causing the anxiolytic effect. It may be an additive property of all of these forms of sensory reduction and internal sensory enhancement. In terms of what's going on in the brain, we have done a lot of debriefing interviews, and in fact, in the 2 papers we published, you could actually see the transcriptions from those debriefing interviews. And the patients talk a lot about how at the beginning of the float, they're having a lot of ruminations and internal cognitions and even some reflections on memories. But about halfway through, suddenly that starts dissipating. And you go into this state where your mind is actually not thinking very much. And to me, this is actually an area of floating that has not been well studied at all, but it could have something to do with the fact that without having all this sensory input coming in, you give the brain a respite. And when you think about modern times and how much we're inundated with stimulation, maybe that's exactly what the nervous system needs.
That sounds like a perfect place to stop. That's a little gift for you. Thank you very much, Justin. And safe trip back.
Yes,
enjoy your last day. Justin's heading out again pretty soon. And he complimented me earlier on by saying how good Melbourne was. That was our first conversation, so he loved Melbourne, which was great. That brings us to Merrin now and our prize draw. I've really enjoyed this session. I think everyone here has as well. So perhaps another round of applause for our 3 keynote speakers. And I think it just encapsulates the variety, the passion, the commitment to making things better for people in terms of mental health, and a great variety of doing that. So I've actually loved chairing it, despite me saying I'm never going to do it again. So thanks, everyone. And here's Merrin.